Welcome to our guide to breast reconstruction. Take a few minutes to familiarize yourself with the procedure and what you can do to help improve your results. Remember, this presentation does not take the place of your consultation, and you should make sure to jot down any questions you may want to ask us later. The goal of breast reconstruction is to restore your appearance in clothes, even your swimsuit. Although there are many reliable methods, a misconception of breast reconstruction is that it will restore the look of your breast while nude. If only one breast needs reconstruction, a cosmetic breast surgery may be suggested to help improve symmetry. Many women feel their confidence and femininity return after breast reconstruction and are pleased with the outcome. Procedure: how will your breast reconstruction be performed? There are many options available for breast reconstruction. We will review 7 of the most popular procedures, including implants, muscle flaps, and microsurgical techniques. Breast implants. This reconstruction is done in 2 phases. In the first, a tissue expander is inserted between the skin and chest muscle to create space for the implant over the course of approximately 4 months. In the second surgery, the tissue expander is removed and replaced by the implant. Muscle flap reconstruction. In muscle flap reconstructions, fat and skin are relocated from one area of your body as the flap to recreate the breast mound. A muscle from the transfer site is also relocated as it contains the blood vessels that supply the tissue. There are 2 common muscle flap procedures. In the transverse rectus abdominis muscle, or tram flap procedure, skin, fat, and muscle from your abdominal area is moved to your chest, providing contour to the reconstructed breast and leaving the tissue connected to its blood supply in the abdomen. In the latissimus dorsi flap procedure, a flap of muscle and skin from your back is rotated to the breast area. An implant may be suggested with both of these flaps. Both techniques will result in scarring on the reconstructed breast and at the donor site. Microsurgical techniques. To recreate the breast with skin and fat without moving a muscle, microsurgical techniques are used to safely separate blood vessels from a muscle. The vessels are then moved to connect and supply the transplanted tissue in the chest. The deep inferior epigastric perforator, or the DIEP, flap procedure is similar to the tram flap procedure, except that the DIEP flap allows the abdominal muscles to remain in place while providing a sufficient blood supply to your newly reconstructed breast tissue. A variation on the DIEP procedure is the superficial inferior epigastric, or SIEA flap procedure, which uses superficial blood vessels in the abdominal fatty tissue. This technique is not always available, as these superficial vessels may be absent in some patients. For women who do not have sufficient abdominal tissue, the same technique used in the DIEP flap procedure can be used in the superior gluteal artery perforator, or S-gap flap procedure, to move tissue from the upper buttock to the chest. The inferior gluteal artery perforator, or I-gap flap procedure, is the variation for transplanting tissue from the bottom of the buttock. Nipple reconstruction. Nipple and areola reconstruction usually takes place about 3 to 4 months after reconstruction. Once the new breast has had time to heal, the nipple and areola can be reconstructed using tissue taken from your own body, along with tattooing to add color. Preparation. Every woman has a unique perspective on what may be the best size and shape for her breast, and your goals will affect the way your breast reconstruction is performed. It is important to discuss your desires and to listen closely so that you can set realistic expectations. A great result can only be achieved when there is good communication between us. Together, we will select the technique that will provide the best result for you. Some suggestions to help you prepare for surgery. Your safety matters to us. You should be very open, provide your medical history, drug allergies, list any previous surgeries, medications, diet pills, vitamins, and herbs you are taking, even if you don't think they're important. Also, don't be afraid to be frank with us about your lifestyle, smoking, the strenuousness of the work you perform, your exercise habits, and the importance of getting back to work. Here are some tips that may help you reduce scarring, shorten your recovery time, and decrease your chances of complications. Discontinue using aspirin, ibuprofen, naproxen, St. John's wort, and vitamin E for 1 week before and a few days after your procedure. These act as blood thinners and could cause problems with blood clotting. Stop smoking and drinking alcohol in excess well in advance of your procedure and for 1 week after surgery. Drink lots of water leading up to your procedure. Hydration will help you recover more quickly. To make your recovery easier and more comfortable, be sure to arrange for someone to take you home and take care of you for at least the first day. Fill your prescriptions and place them within easy reach of where you will be resting. Place plenty of pillows or a bed wedge nearby so that you can keep your back elevated. Have several loose-fitting button-down blouses ready to wear, as they will be easier to change in and out of while you recover. If you have a tram flap reconstruction, loose-fitting pants and slip-on shoes will make dressing easier and more comfortable. You should not lift anything heavier than a couple of pounds after the procedure, so you may want to buy smaller containers of food, like pints of milk instead of a gallon. If you have pets, repackage large bags of cat and dog food into smaller, manageable containers. Recovery. Because there are so many variations in technique and levels of intensity, recovery varies greatly. Rest assured that we will address your needs and give you more information once a specific treatment plan has been decided upon. In general, pain after surgery will be controlled with appropriate medications. During the first 2 to 4 days, your pain medication will be needed regularly. After this time, the medication is needed less frequently. Severe pain is not normal, and we would want to know about it immediately. Strenuous activity, as well as sexual activity, must not be engaged in for several weeks. It may take up to 6 weeks to recover from combined surgery. Scars take some time to settle, usually between 6 to 24 months. The amount of time it takes for you to return to work may differ if you are having breast reconstruction performed right after a mastectomy or in the following weeks, but expect to be out of work for approximately 4 to 8 weeks. As with all medical procedures, be sure to choose your surgeon wisely. It is important to choose an experienced surgeon you can trust and develop a good rapport with, so you can openly discuss your concerns and particular needs throughout the process of consultation, surgery, and aftercare. Should you decide to move forward with your breast reconstruction, a surgery date will be scheduled. Prior to surgery, you will be given complete preparation and recovery instructions. Remember to keep your follow-up visits, as we are here to help you. Feel free to review any part of this presentation you like, and be sure to take a look at our before and after gallery to get a better idea of the results you may achieve.